there's a lot of misunderstanding about this whole idea of single-payer healthcare, health management organizations, basically the government getting heavily involved in the idea of healthcare, so as to keep prices under control. And all it really takes is doing kind of a few degrees of digging on it. You end up finding out, well, no, it's doctors helped fix the market so that they end up getting paid at a certain level, because there was huge inputs, but there simply were not the level of accruing of monies. So doctors would end up basically as wealthy as a very, very smart contractor who, say, was a contractor, then ran a firm. Then a doctor basically would start their career 10 years later, work extremely hard, but end up in the same neighborhood as them. And this pissed off a lot of doctors. And then there was also certain specializations that they're like, no, that then there was this. Okay, have you ever noticed how there's an area where there are kind of a cluster of a certain industry of offices? Well, it could very well be that your city zones where you could put medical offices. That's actually very, very, very likely. It is to limit how many medical offices there are. This also then limits how many medical practices there are, the price it takes to get into the field, because it could be that you're someplace that it's a large enough area that if they had like a lot of places zoned for small practices, it would be great. But no, they have like 2 hospitals and very little zoning for private practices. So what you end up having to do is work for the hospital. And that's when you're roped into this entire system of government intervention into healthcare. And now there's this. You have seen Obamacare work already. Most of you own an Obamacare device and you don't know. If you own a watch that measures any physiological data about yourself, that came from Obama's administration and data-driven healthcare. The whole idea about the new generation of healthcare is mostly wellness and lifestyle things based on data on what is most likely to kill you early. That's all it really is. We have to dress it up as something a little bit more sexy, really, so that somebody can make money on it. Somebody's basically selling you rims. They're not selling you healthcare. Everyone's selling you rims. Everyone's selling you ground effect kits. They're not selling you healthcare. The wellness part of it is choice. It's just that we don't have anything that incentivizes wellness yet. And I mean, really think about that one. Because of the way insurance works, if you are healthier, you should pay less, in a way, because you're less of a risk. But what we've messed it up, what the government has messed up by intervening into healthcare so much that now it's sort of like everybody's paying for the most unhealthy person in the insurance pool. But they have no way of getting that person to change their lifestyle toward health. And then there's this. What was discovered in the world of wellness a long time ago? Certain people just die of certain things. Like groups of people are just likely to die of certain diseases. It just happened to evolve within their group. Some groups of people, they just live shorter. Some groups of people live a really long time. Wellness, it also gets into, why would you want to live a really long time? Like, very seriously, like, at some point you'd be old, and you'd be old for a really long time. So this whole idea of the universal health care and all that talk, it depends on what you really want, and then what you think health care, universalizing healthcare, what would it look like? So, yeah. All right, later.